Hi, I'm Gianni and I'm a senior.
Hi, I'm Harley and I am a junior.
Hi, I'm Gabby, I'm a junior.
Hi, I'm Leslie and I'm a senior.
Hey, I'm Cameron and I'm a senior, and we're all from Winthrop University.
Today we're going to be talking about PNF stretching and strengthening.
Alright, so what is PNF? PNF is proprioceptive neuromuscular facilitation. So what it is, it's based on the principles of functional anatomy. A lot of times it's a more advanced form of flexibility training, and it's usually doing to mimic a lot of sports-related movements. So proprioceptive is a cutaneous auditory input. A lot of times it's stretching and contracting of the muscle group that's being targeted.
What is PNF used for? It's used for boosting flexibility, range of motion, and strength. Also, passive range of motion and active range of motion can increase.
Alright, so some of the precautions with PNF stretching and strengthening, don't apply the maximum force because a lot of times we're not trying to injure that muscle group. We're just trying to stretch it out or sometimes strengthen it gradually. The smaller the muscle group, the less force is going to be needed. And a lot of times you're going to want to warm up before stretching. That way you're again not injuring that muscle group and you're not as tight whenever you're doing these motions because it does allow for contractive forces during the stretching or strengthening. So communication between the athlete as the athletic trainer is very important.
So next we're going to talk about the physiology of PNF stretching. In PNF stretching, not only are the muscles and tendons stretched, they are also contracted. This elongates the length, decreasing the nociception or the pain that is produced by the GTOs. The GTOs are also known as the Golgi tendon organs. The GTOs then adapt to increase in length and force threshold, which allows for greater force production. Next we have the types of PNF stretching. The first type is hold relax. The second type is contract relax. And the third type is hold relax contract. Now we're going to show you some videos on how to do these.
Okay, so right now I'm going to show you how to do hold relax contraction for the PNF stretching. So with this, I'm going to ask the athlete to bring her toes to the farthest point she can go with her nose. So bring this up as far as you can go. So she's almost getting up to a right angle. So I would back up, push her a little farther. Now I'm going to ask her to do a contraction, pushing her heel down to the mat. But while she's pushing the heel down to the mat, I'm going to resist. I'm usually going to resist for 6 to 10 seconds, just so the GTOs can activate and let this muscle spindles know that there's nothing wrong with that the muscle is protected. So after she's pushing my heel down, I'm resisting with this arm right here. I relax, about 5 seconds. And now you're going to notice that you're going to be able to take her a little bit farther in the stretch. And I'm going to ask her to push down again. Push, keep pushing, keep pushing. Same thing, one more time. Now you're going to get to the final phase. You're going to push her even farther. Push, 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 and relax. Now you notice when we started that stretch, she can only get up to here, and now she's able to get back here. All right, for this one, it's going to be the same thing. It's almost hold relax, but a little bit differently. Can you bring your toes all the way up to the ceiling for me at the farthest point? So I'm also going to, again, the 6 to 10 hold just for the GTOs and the muscle spindles. Now, different to this one, where I would hold her while she's pushing down. This one, she's going to push, and I'm going to slowly resist her all the way down to the table. Same thing again, relax, bring it up as far as you can. Push me down to the table, push, push, push. One more time. Push, push, push all the way down to the table. Now, if you're working with like a football player or a bigger athlete, you might want to position yourself like this. It just gives you more leverage for a stronger athlete. For the final PNF stretch, I'm going to do hold, relax, contract. So with this one, same thing. You're going to get the athlete to bring her toes up to as far as she can. Now with this one, I'm going to ask her to engage her hip flexors so she can bring her foot actively closer to her like this. And I'm going to hold her to that stretch. Then same thing, relax, then tell her to bring it up. Then engage the hip flexors. There you go. Same. One last time. Now, engage them. The difference between this and every other stretch that we did is she's actively going with my resistance versus going against my resistance.
All right, next we have PNF strengthening. So with PNF strengthening, you have a few types. The top three components, a lot of the exercise patterns, you'll have flexion and extension, abduction and adduction, and then also internal, external rotation. Those are the three components, and all of these types of movements, which is key to see the athlete doing. With these athletes or players, you'll see a lot of rotational and diagonal exercise patterns. They're going to be the most closest to similar motions you'll see like in sports. So example, with upper extremity, you'll have rotational forces that will mimic like baseball or other things that are going to be very similar to sport related. Alright, the two types we have are upper and lower extremity, and you'll have diagonal. So you'll have diagonal 1 and diagonal 2, and that will be shown in the videos.
Okay, for this one we're going to do PNF strengthening. So for the first one, D1 upper extremity. To increase shoulder extension, you're going to want to first get her to grip down on your fingers like this, and it's almost like, and then her chin is going to be tucked. It's almost like she's eating an apple and then tossing it away. So it's going to be this motion right here. You're going to instruct the patient to watch her hand the whole time, and then you're going to want to go down, and she's going to finish with her fingers abducted and her thumb pointed down on the ground. Now, to increase D1 shoulder flexion, you're going to do the complete opposite. You're going to here, and then you're going to force her fingers in, and then she's going to end back into the position you started in. Now, for D2 shoulder flexion, you're going to start here, thumb down. It's almost like taking out a sword and throwing it away. You're going to here, and you're going to go up, thumb down, and tossing it. Now to increase D2 shoulder extension, you're going to do the complete opposite again. Tuck the thumb. Now to increase PNF strengthening for D1 lower extremity flexion, you're going to apply resistance on the foot, and your other hand is going to be right here. Now in this motion, she's going to bring her hip up, foot's going to internally rotate, and her hip's going to externally rotate. That's for D1 lower extremity flexion. Now to do the complete opposite for D1 lower extremity extension, she's going to evert her foot. I'm going to internally rotate her hip, and we're going to finish here. For PNF strengthening D2 lower extremity, her foot is going to be plantar flexed, and her toes are also going to be flexed. And I'm going to be resisting the motion of eversion and a dorsiflexion, and her toes going into the extension. Also, I'm going to be resisting her hip going into internal rotation. So it's going to be this motion right here. Now to increase lower extremity D2 hip extension, it's going to be the complete opposite. So she's going to be bringing her hip in, her toes in, her foot in. I'm resisting it all the way down until we're back into the starting motion.
Alright, again, that was our presentation on PNF stretching and strengthening. If you like our video, then you can follow us on Instagram at WU_athletic training for pictures and comments or content. And thank you again for watching. Bye.
Bye.